Well, good evening and thanks for joining us tonight here on News 20 on GTN. I'm Randy Gardner. We've got a great show for you tonight, very informative. Joining me to my right, we have Karen McKay. Glad you could join us here tonight on the show.
Hi, Randy. It's good seeing you.
And to your right, we have Tim Freeman, the Missouri Grassroots Director of ACS Can. Glad you could join us. We appreciate it.
Thanks for having us.
Karen, your title, I think everybody knows. You've been on the show for a million times, but District Lead, 1st Congressional District. Explain what that means.
Well, actually, we have 8 congressional districts here in Missouri. The 1st Congressional happens to be in this area, downtown, part of North St. Louis County. It's pretty big, maybe 500,000 people. So I represent the people that are in this district, and so I deal with the legislators on state, local, and federal levels as often as I possibly can. And
we'll get into that much more in a sec. But Tim, the words ACS Can, explain what that means to the general public.
Sure. It's the American Cancer Society Cancer Action Network. So we are the advocacy affiliate of the American Cancer Society. So sister organization with ACS, folks that know ACS through Relay for Life, making strides against breast cancer, those types of events. We're just the advocacy affiliate of the American Cancer Society.
Kind of walk us back how that basically became. Has it been several years, and how did that branch off happen?
Yeah, it's been 11 years now. Basically what the folks at ACS realized was that everything that they're doing to raise awareness about cancer issues, raise money to support cancer research, they knew that they needed to do more, and one way to do that was through advocacy. Laws that were being passed, whether it's smoke-free laws at the local level, laws down in Jeff City, laws out in Washington, D.C., all of those things are affecting the fight against cancer, and so they really knew that they needed to have some type of volunteer effort aimed at lawmakers to increase awareness and to pass some good laws in the fight against cancer, and so that's how ACS Can came about.
When you look at individuals like Karen, and Karen, you got to be quiet, you can't say anything here, we're not going to let you talk. When you look at individuals like Karen and what she has done, and there's individuals like her all across this country, what do they mean to what you do?
They mean everything. What ACS Can is a volunteer army is the way that we look at it. And without folks like Karen, who put in the amount of time they do, and she will never brag on herself, but Karen has been an ACS Can volunteer for the 1st Congressional District since the beginning of ACS Can. And it's folks like her all across the country who have a passion for fighting cancer, personal stories, reasons that they're involved. They're the ones that go to these legislators and talk about issues, and they're the ones that really resonate. You know, I can take a folder of information into a legislator, and they'll look at it and they'll take some time and talk to me, and that's great. But when Karen goes in and tells those personal stories, those are the things that make a difference. And the volunteers that we have like that all across the country, they're really what make ACS Can work.
Karen, I know you're very humble and you'll never admit up to everything you do, but when you hear Tim talk about you like that, how does it make you feel?
Well, it's kind of embarrassing sometimes because I'm just a volunteer. You know, I just volunteer with the American Cancer Society. It was probably a couple of decades before the Relay for Life got popular here, which you were always involved in. And it's just one of those things where you just do it because there's a passion for it, or there's something that I think God puts us all on this earth for reasons, and you fulfill each step of your life, and this is just something I'm passionate about.
Did you ever think back when you first got your hands wet in this whole thing that you'd go through all the different levels and be where you are at today?
You know, it was all because other people joined together. You know, that old saying, it takes a village. With the Look Good, Feel Better program, I was lucky enough to be part of the National Cosmetology Association, and we actually kind of started it here in St. Louis, and then the American Cancer Society kind of joined into it. So that's a program that's been going on since the 80s. And that's really when I got involved with volunteering with the American Cancer Society through what I do for a living. Then when, of course, you know, when we were in the Rotary, Clinton Vance asked me if I would help, be one of the chairs with the Relay for Life, and that just kind of snowballed. We had such wonderful organizations here in North St. Louis County. We had so many good people here in the community, great hospitals, and of course we had the staff people at the American Cancer Society who just inundated us with all kinds of information, education, things that would help us to put on these events. And it's one of the signature events for the American Cancer Society is the Relay for Life. Although, again, it has gone through changes over all these years. But I look back at some of the wonderful people some of the people back years ago that were not going to have a good prognosis when they were diagnosed with cancer. And in today's world, we have almost 15 million people just in the United States right now who are survivors.
Tim, there's so many people out there who, per se, think they do important things in life for a living. With what you do, you touch so many people every single day. Do you see that and feel that? Do you recognize what your organization and yourself are really doing?
I do. It's very humbling. We're part of a 1 degree movement right now because basically everybody you know is 1 degree from someone who has cancer. We all know a family member, a friend, somebody that's been affected by cancer. My mom's a cancer survivor, lost family members and friends recently to cancer. And so when you reflect on it from that perspective, it does bring a different type of meaning to the work that we do and the volunteers that we get to work with. And just seeing the passion that they have and then knowing that we make a difference when a law does get passed or funding gets increased, it really does kind of hit home when you reflect on it.
Karen, we did this for so many years and did so many different things, and I was so bought into it, but then once I experienced it and went through it firsthand in my life, it really changed the way and I guess the degree that I feel about what I'm doing. Were you the same way?
1 degree. 1 degree, away from knowing somebody or having somebody, a loved one, a friend affected by cancer. I guess I was really brought into it again back when I was part of the Look Good, Feel Better program, and again, because of all of the years of watching the progress, that some of the funding that comes from our national government, how that affects research and how it has exacerbated into this wonderful area of having the Cancer Action Network and all of these people that are joining into this force. There are one person representing each of the congressional districts when we go and talk to legislators. But there's an enormous army behind us that goes with us, and that's part of my job as somebody who represents this district, to also go out and advocate to others you don't have to be a past legislator or somebody that's been in politics. You just have to have a passion and a desire to help, find ways that we can get our national government, our local governments, and our state governments to help keep all the funding we need in place for research.
With this such an epidemic, in this world, what would you say to the average individual? We have you guys on the same time every year to promote several different things, but what would you say year-round can an individual do out there who's watching this show to become involved, to get the message? Because it needs to be spread.
Yeah. We would encourage people to go to our website, acscan.org, and get more information there. Really, becoming a ACS Can member is a great step, but like we said, everybody knows somebody, so everybody is aware of it all the time. And advocacy, we really try to break it down to a simple phrase, and that's just making your voice heard on an issue that's important to you. So if you're touched by cancer and you want to make a difference and you want to make your voice heard, and a lot of people, I totally understand, they think advocacy, they think politics, and that's not what we do. We don't do politics, we do advocacy, and it's different. So we make people, give them an opportunity to make their voice heard to their legislators, and I can promise you, I've sat across the desk from legislators, I've worked for legislators, I can tell folks out there who may be thinking, well, maybe I can't make a difference. Those personal stories make a difference. When a vote comes up, they're not going to remember the stats that we gave them on a sheet of paper. They're going to remember folks like Karen or other folks out there who are listening to this today that made a phone call or came and visited with them and told them a personal story. That's what they're going to remember, and that's what can make a difference. And so I would encourage folks that do have a story, please get involved that way.
When you look at getting involved, is it the first thing, no matter what you're doing, the first thing people say is, well, how much time, how much commitment? Is it as simple as maybe a phone call, a letter, all the way up to being involved like what Karen, all different levels? Absolutely.
We can have a level for anybody in any way they want to get involved. We can make advocacy as simple as a click of a mouse. We send emails out when an issue comes up of importance. If you're an ACS Can member, you'll get an email that will say, here's the issue, click here to have some more information, click here again, fill in your information, click send, and it will send your information, your plea off to your member of Congress or your state legislator, and let them know that you care. So we can make advocacy that simple. If folks want to get more involved, we can set up meetings with legislators for them. They can put in as much time as they want, but we really do try to make advocacy as simple as possible. People can do it in the evenings, they can do it directly from their phone, anything that they want, any level of involvement that they want to have, we can find a fit for them.
Karen, I know if I say I'm going to open the floor up to you, me and Tim will be
We
here
don't
till
have time. We don't have
4 or
enough
5
time.
hours from now. But I am going to open the floor up
Oh
and
my
let
goodness,
you
here we
just
go.
kind of have at it for a couple minutes, because we could sit and listen to stories after story after story, and each one is so personal.
They are, and again, I've had the great honor to know you and to know Tim and a lot of people that I've met over the years through the American Cancer Society, and each of you have been a big help in all the directions that we go in to, trying to help other people get involved with the American Cancer Society or with Cancer Action Network. Again, after the ACS Can really got started, I was basically in local politics at the time, and I was pretty much had enough chairing the relay, and again, it was at a great place and it needed to go on. So there are other people, they're always going to step in. There's always people with the same, desires to try to help out however they can. And it was kind of a good lateral move for me when the advocacy side started, because having been in local politics, I was lucky enough to know some of the legislators. And then I share that with the people that are actually asking, hey, how do I get involved with ACS Can? You don't have to be knocking on the doors. Just like Tim said, it's as simple as a click of a mouse. If we can forward you some information, here's some things that you can do that can get to your legislators. Make a phone call. I've become very friendly, and I've found that to be the best avenue with staff members. Because a lot of times we'll just use my congressman is in Washington all the time. He has offices here. And so we'll make visits to their offices. Even our senators, they have offices right here in St. Louis. Tim will come in, God love him, he comes in and he goes to these meetings, and like you say, he hands the literature that the American Cancer Society Cancer Action Network has available for us, with all of the litany of things that we need for them to pay attention to. But then they want to hear about their constituents. They want to hear stories about people that they represent. And then it puts that face and it puts that story in there right in front of them. And some of our legislators have already themselves been cancer survivors. They understand. I find that it's not just the cancer survivors, but it's also the family members. Over the years, I've taken stories to Washington, and my congressman has been very good about sitting and watching me as I go through step by step and tell the stories about somebody who has gone through the perils of cancer and treatment, came out on the other side as a survivor, or maybe lost their battle. But then you have those family members that are back home. And this morning, I can't even tell you, I can't even go into this story, because one of my friends who used to be on our Florissant Police Department is retired, and he's going through cancer. And he went through a year of esophagus cancer, got through all the treatments, went in, had his test, and had a clean bill of health. But you never know, when that one cell may rear its ugly head. And it wound up, now he has a stage 4 lung cancer. And the story that I want to share when I go to Washington next month to the legislators is not only his story, but his wife's story, who's a nurse, and their children and their stepchildren, and how this metastasized throughout the whole family. You know that as your mother being a cancer survivor. It doesn't just affect the cancer survivor. And so the American Cancer Society, the Cancer Action Network have all of these different avenues that we can help people with. You're not alone. The American Cancer Society and the American Cancer Society Cancer Action Network have a brand that people know, and we walk in the door with that brand, and so we can help people the best we can through the stories that we share for them. So we're kind of that conduit that goes, and here we are. And here I'm going to tell you a story if I can get through it without tears.
Tim, I'll ask you, for you, is this, I know it's a very gratifying position, but is it also in some ways a sad position because of the fact that you're dealing with such heavy information all the time?
It is. Just last week, in fact, we had a meeting, a roundtable discussion with Senator Roy Blunt. He came to Columbia. We were at the university hospital there in Columbia. The chancellor was there, the dean of the medical student, one of the researchers were there, talking about the importance of federal funding. And we, as the American Cancer Society Cancer Action Network, brought in 5 survivors and caregivers. One was a close friend of mine who had lost her husband earlier this year to brain cancer. There was a family from Fulton who lost their 6-year-old son last year. A Ewing sarcoma survivor who's a student at the University of Missouri, a melanoma survivor, and a brain cancer survivor. And those 5 folks, sat at a table and told their stories to Senator Blunt. He spent over an hour listening to their stories. I had met with all of them before, as I mentioned. Nicole Nichols, who's a friend of mine who lost her husband Ross earlier this year, personal friends of mine. So believe me, I've done my crying with the Nichols. But when I met with each of the other 4 that were there prior to the meeting with Senator Blunt, I didn't get through one of those meetings without shedding a tear. Not just for them, but as Karen mentioned, the caregivers and the folks that are with them, their husbands, their wives, the siblings that are left behind, all of those types of things. So it can be a sad job when you hear those stories, but then when we know that we are advocating for those folks, it gives you a sort of a sense of peace that you're actually doing something to help them. You're not just listening to their story and feeling sad with them, but then, okay, now I'm going to go do this, and we're going to accomplish this together, and your story is going to help us do that. So sad, but gratifying at the same time.
And do you see that once somebody goes through it, like these families, that they're willing to basically go to the end of the line to get their message across?
Absolutely. Nicole told me that. She wanted to share Ross's story. The Santifs, who lost their son, they have their own foundation set up, but they told Sam when he was going through his treatments that we will tell your story. That is going to be your legacy. We're going to share your story, and we're going to accomplish things for childhood cancer. And giving them that opportunity to sit down with their United States Senator and tell their story was extremely gratifying for me, and I know it was for them too, to have that opportunity to share their son's story and to keep his legacy alive in that way.
And other than that, just a healing mechanism.
Absolutely.
For any individual going through this.
Absolutely.
All right, Karen, we've got so many things coming up over the next few months. Let's touch on a few of the things that people can get their hands on. Where can they go to find out more information about it also?
Again, www.acscan.org is the website. It is a litany of information, and if you need to get a hold of myself or get a hold of Tim, since I'm here in this district, they can give me a call, and you can post that online if you want to, or if you want to put it up during it. But they can call me at area code 314-838-2313. They can look for me on Facebook, because my Facebook page is nothing but the American Cancer Society. And if they want to get a hold of Tim, you want to give your credentials?
Yeah, tim.freeman@cancer.org is my email. We have an ACS Can Facebook page as well as an ACS Can website, and we actually just last year launched an app. So if you want to go on your phone and search ACS Can in the App Store on your phone, you can download the ACS Can app. You can get all of our emails, our newsletters. It shows you how to reach out directly to your member of Congress or your local elected officials straight from the app. You can do it right there on your phone. So trying to make advocacy as easy as we possibly can. And then we're going to be going to D.C. At the end of September as well, that we do each year, and Karen can probably talk a little bit more about that and the Lights of Hope that we'll have there. But we'll be meeting directly with our members of Congress in September, so we're looking forward to that as well.
Let's touch on that, and then I've got a couple things I want to ask you, but let's touch on that trip and how much of a difference that makes being there in person.
It really does make a difference. I remember back when the very first, it was the Relay for Life celebration on the Hill back in 2012. You came down and helped us with, in fact, you know me, I always have to document everything. I put together a book that from the beginning of ACS Can and to date, and I try to keep it updated with some of the things and the things that we've done, some of the accomplishments. And I try to update this and give this to our legislators when I'm in Washington. And I'm lucky enough to have meetings with my congressman. We sit down and we go through these stages. And again, he looks back at me and he goes, golly, it's been that long. And I said, yeah, it really has. But the things that we have strived to change, if you can get your legislator on board with you, so many of them, it's a nonpartisan thing. You know, I don't care if you're a Democrat or Republican. I'm going up there as just somebody that speaks for the people in this district. And of course, anybody that I know that has cancer, but basically because those are the people that he deals with. Same thing with our senators, you know. The summit is worth its weight in gold. We go up, each of the congressional districts has somebody that represents them. ACS takes care of getting our meetings set up ahead of time unless you really have a different rapport with your legislator, but we really try to follow protocol and let them set up everything for us. They get us there, they give us a whole bunch of training the days before we go up on the Hill. We spend the entire day on the Hill, early in the morning, and we come back late in the evening. We have no idea when our meetings are going to be, but we try to go as a group to meet with our senators. And then our individual meetings we'll have with our congressmen. And then when they kind of, Tim and another young woman from the other side of the state, they kind of break us up in groups. And if they get somebody like me that's been doing it for a while, they will kind of say, why don't you go with this one to their meeting if it's close around the same time, or if we're in the same house, because you can maybe be in the Rayburn house and all of a sudden you're running to the other side of the Capitol with one of your other advocates. So we work it out as a team, and the 8 of us, district leads and our staff partners are just, it's a work in progress. And I'm going to tell you, the meetings they're really insightful. And we've had meetings on the steps of the Capitol. We've had meetings in the hallways. We've had meetings that weren't even planned. All of a sudden, I caught Senator McCaskill in the hallway. And so we just had a meeting, but I'd like to talk to you about something else, why I have your attention. And she was on her way back to her office, but she took the time to stop for a minute and listen to us. So, these are people that they know we're coming. And when you see a bunch of us in our blue shirts and we're all there in numbers, we're knocking on the door, and some of us are very fortunate to have our legislators there at the door waiting for us.
When you see how hard Karen and yourself and the group here works, is this going on all over the country?
It is. So all 435 members of the United States House of Representatives, we have an advocate for like Karen in that district. And then we have one main advocate in each state for the 2 United States senators. So those 435 plus those 50, 485, plus a lot of the ACT leads like Karen have people on their ACT team, so they have other team members. So we'll have over 500 advocates that will go to Washington, D.C. with us at the end of September. And as Karen said, we'll all be wearing our blue shirts. They won't be able to miss us on Capitol Hill. When we walk in the office, they know who we are. They know what we're there to talk about. We have 3 key issues that we want to talk about this year, and we can talk about more about those if you'd like. But it makes a difference. And we try to get personal meetings with each of the members. Sometimes we have to meet with staff, but it makes an impact when that many folks take the time to come to Washington, D.C. for 4 days to meet with their legislators on the Hill.
We've got about 5 minutes left. I definitely want to, let's touch on those 3.
Sure.
But before we do, I quickly want to ask you, for the people who don't understand the structure of how it all works in terms of Congress and senators and how it's all voted on and when it's voted on and how you get money. Is there a certain time you go in September?
Right.
Is there a certain time there's a vote? Kind of walk us through that.
So earlier this year, perfect example, the reason we met with Senator Blunt is he's the chairman of a Senate Appropriations Committee that is in charge of funding the National Institutes of Health. And that's where the National Cancer Institute is also housed. And so earlier this year, in March, in fact, Senator Blunt added $2 billion of an increase for NIH. And so when we met with him last week, we wanted to just make sure that as the budget process continues, when he goes back, they're on August recess right now, but when they go back, the Senate passed their version of the budget, which had the $2 million increase from Senator Blunt. The House passed their own version, which was a little different than the Senate version. So when they go back in September, they're going to have to come together for one budget. So when we go at the end of September, they'll be right in the middle of those budget negotiations. And so that's why the power of these 500 or so advocates that are going to be out there, the timing is perfect as far as the budget goes. We're going to tell them, $2 billion increase in the Senate side. House was a little less. Let's go with the Senate side. And you know what? Let's do a little more than $2 billion if we can. So that's what we fight for. And Senator Blunt's going to be a key advocate on that just because of the position he's in. Senator McCaskill. There are very few legislators that don't agree with an increase for federal funding. It's just how do we go about paying for it. And what we say is, you know what? You guys are going to spend that money somewhere. Let's spend it on cancer research.
All right, 3 minutes here. 1 minute a topic.
Cancer research funding is always going to be number one. The second one is a palliative care, quality of life legislation. When people hear the words, you have cancer, they want to think about what's the best way that I can get treated for my cancer. And that usually includes a team, not just your oncologist, but a primary care doc, a nurse, a nutritionist, maybe a psychologist. We want to make sure all those folks are working together for the best treatment and the best care of the patient. And so this quality of life bill will provide some training for hospitals so they can have quality of life programs at their hospitals and patients can be aware of those. So that's one piece. Then the third piece is more of a technical bill. It's a fix to a colorectal cancer screening issue that's come up through Medicare. Right now, if you find a polyp during a screening, it's changed to a diagnostic procedure rather than a screening. And once it's changed, then folks are required to pay their copay. If it's just a screening, they don't. Anyway, it's a little technical, but we want to try to get that fixed so that people don't have a disincentive to go get their colonoscopies. We want people to go and get those. So prevention is always number one, and we don't want people to be faced with a bill when they do the right thing by going in and getting the screening.
I know that was a crash course in those three, but you can find everything on the website, correct?
Absolutely, yes.
All right. Karen, leave you with the last word here. What would you want everybody to know about everything we talked about today and the group effort for this big push?
Again, go to the website and take a look at the information that the American Cancer Society Cancer Action Network has there for you. It may be a little convoluting, it may be a little hard for some people to kind of go through if they don't understand the process with getting with legislators, excuse me. But the one thing that I found that was the easiest was making a phone call and talking to somebody like Tim, who can sit there in 2 or 3 minutes and explain it to you very simply. A lot of the legislation that we are going to be going back talking about this year is information that we gave them 2 and 3 years. But as it's moved through the process, some of it didn't get on the floor for a vote. So we don't just take it for granted that next year when we come back, just, oh, well, those same people are going to be on. They're going to take, they're going to go ahead and stay with that. That bill may have changed. So we have to go back, we have to give them the same information and any updates, and then be hopeful that the process moves a little faster.
Tim, final words.
I just want people to know that their voice and their stories can make a difference. If they'd like to join ACS Can, I promise we make advocacy as simple as possible. We have great folks out there like Karen who are doing tremendous things, but we make it as simple as possible, and your voice can make a difference.
Guys, we appreciate your time. Karen McKay and Tim Freeman, acscan.org for more information. You guys have a wonderful day. Thank you so much.
Thanks,
and thank you for joining us here on News 20 on GTN. Have a good evening. We'll see you tomorrow. All right.
Marine Corps Sergeant Andy Robinson was paralyzed when his Humvee was blown up in Iraq. Paralyzed Veterans of America helped Andy get all the health care and benefits he's entitled to. To support paralyzed veterans, go to pva.org.
The ants go marching 2 by 2, hurrah, hurrah. The ants go marching 2 by 2, hurrah.
The spider went up the water spout. Down came the rain and washed the spider out. Out came the sun.
And Mama's wife, she climbed that house with the closet. Now, did you ever see such a thing in your life as 3 blind mice? 3 blind mice.
Marine Corps Sergeant Andy Robinson was paralyzed when his Humvee was blown up in Iraq. Paralyzed Veterans of America helped Andy get all the health care and benefits he's entitled to. To support paralyzed veterans, go to pva.org.